بسم الله. اليوم الموضوع عن it's not only the viral hepatitis but in general the acute hepatitis. Okay, a lot of the credit for this slides goes to Dr. Naif Al-Rataibi, one of the infectious disease consultant بالمستشفى الجامعي. Okay. طيب, what is hepatitis? It's very simple. It's basically an inflammation of the liver. Okay, so from its name, titis, inflammation, hepa is the liver. Okay, and this condition can be self-limiting, but it also can progress to fibrosis and eventually cirrhosis of the liver or even cancer. Okay, hepatitis viruses are the most common causes of hepatitis in the world, but other infection, toxin like alcohol, drugs, autoimmune disease also can cause hepatitis. So it's a long list of causes for hepatitis, but globally speaking, viral hepatitis are the common one. You can see here, a global number of deaths due to viral hepatitis or HIV or malaria or TB. So you guys can see that the hepatitis over time, there is actually increase in the number. Okay, compare this to malaria, there is a decrease. Compare this to TB, there is a decrease. Compare this to HIV, there is actually a decrease. Are you guys surprised by that? Maybe. Okay, and this is the mortality rate from all over the globe. You can see that the East is different than the West. Okay, so the East, we're talking about China and East Asian countries, we see the burden of hepatitis B being the common one. Okay, the dark green here. Compare this to the Western countries, where we see hepatitis C is actually the driving cause for the hepatitis death. Okay, so there is a difference between the East and the West countries. Okay, this is a good slide for those people interested in global health, because the WHO usually will have some initiative and goals to achieve. So they are trying to communicate with all the countries to decrease the burden of a certain common diseases in the globe. So for example, when it comes to the mortality from hepatitis B and C, okay, the goal in 2030 is to reduce it by 65%. The goal in 2020 to reduce it by 10%. So they will have the goal first, and then they will have some initiative, sometimes country-based, sometimes continent-based, to try to achieve this goal, okay? And this is true not only for hepatitis, this is true for hepatitis, HIV, malaria, TB. Those are a global infectious disease burden, okay? Okay, so now let's talk about the viral hepatitis. We are aware of 5 types, A, B, C, D, E. Okay, who knows? There might be more than those 5 letters. We know that hepatitis A and E usually doesn't cause chronic infection. Usually they are acute. And the source of the virus or the mode of transmission for A and E, they are similar. It's through fecal material, while B and C and D, they can be actually from the blood. Okay. When it comes to immunization, we have for A immunization, we have for B, we have for D, but we don't have for B and E. Okay. So they are one family, they are the viral hepatitis family, but each can behave differently. Okay, so how to diagnose hepatitis? Well, Patient history also always being suggestive. Physical examination, liver function test, as well as serological tests. So what are the symptoms or the signs may suggest a state of hepatitis? Well, anorexia, fatigue, nausea, vomiting, arthralgia, myalgia, headache, those are symptoms may suggest a state of hepatitis. While examination, you may have basically jaundice in the eyes, ecteric face, enlarged liver, tender even liver, splenomegaly, and adenopathy. Okay. How about the labs? Well, you can have an increase in the liver function test 5 to 10 times of normal, and you also can check the markers for hepatitis B, C, or A might be positive. Okay, so let's take a case. You have Ahmed. He's a 50 years old teacher living in Jazan, presented with abdominal pain, nausea, loss of appetite, and discoloration of his urine. He has a marked jaundice. His ALT were in the 1,000 club, as well as the AST reaching 1,000. His bilirubin is elevated as 9.5. Sorry, 9.5. The bilirubin, the platelets are 267, so still within normal. This is in 30th of September. 1 month later, there is an improvement in his ALT, AST, alkaline phosphatase slightly elevated, GGT slightly elevated, bilirubin is now 1.4, platelet 14,000. Sorry, this is the PT, is 14, it's normal, and platelets are 88,000 only. So, what do you think going on? What's our differential so far? Malaria, someone took the area he's coming from. But does malaria presented with those symptoms, abdominal pain? Maybe. Nausea, vomiting, yes. They may end up having nausea and vomiting. Hepatitis A, yes. Good thoughts. I would say any of the hepatitis, especially A and E, that's good. Okay. So those are the common, and of course, because they are the topic of today, but don't forget about the other causes, which we're going to talk about shortly. So really the differential diagnosis for him, including acute viral hepatitis, including A طبعا, drug-induced hepatitis, so in particular we'll have to ask about hepatitis. Maybe he will have some chronic hepatitis, alcohol hepatitis related to drinking, cholestasis or cholithiasis, because they are common, and autoimmune hepatitis. So what are the hepatitis B marker? Okay. I don't know if you guys took that in the medicine 1, but hepatitis B markers are complicated a little bit, okay? But we're trying to make it simple. So we'll take hepatitis. I don't know what's HepSag, but
غلطة دكتور. هيباتيتس أقصد surface antigen, surface antibody, core antibody.
Okay, we'll talk about them. You guys see the screen or you don't see the screen?
إيه شوف.
ممتاز. Okay. So you're saying something, you are asking question ولا you're Hello? Okay. Joe. Okay. So let's talk about hepatitis B markers. Let's take the state and then see what the marker is going to be there. I think that's one of the easiest way to remember them. So if you get immunization for hepatitis B, if you get immune, if you get vaccine basically, okay? you're only gonna have the surface antigen antibody being positive, okay? Because the vaccine only containing the surface. It doesn't contain any of the core of the virus, okay? So when you have only antibodies against the surface, that's meaning you got immunized in the past, okay? Compare this to someone have the infection. So they get the infection and they get cured from the infection, okay? So they're still gonna have the surface antigen being positive because now they are immunized against the infection after a natural infection, but also they're gonna have an antibodies against the core. So this is actually a core difference between the immunization, history of vaccination, and resolved infection. Okay? How about acute infection? Whenever you see the surface antigen, the surface antigen being positive, you have to get worried. Why is that? Because whether you are actually having an acute infection or you have inactive chronic hepatitis B, so it's now inactive, but it may become active shortly, or you have an immune active chronic hepatitis. Okay? So, and those three states, basically, you still have the virus inside your body. Okay? So, this is when you have to worry. When you have to worry, when you have the surface antigen being positive. When you have to relax, you can relax when you see that you have an antibody against the surface antigen. Okay, so you have antibody against the surface antigen. That's meaning whether you get immunization through vaccination or immunization against after a resolved infection. Is this clear, guys? Good. But this is just a summary. If you have antibodies against surface antigen, this is immunity. If you have the antigen itself, that's meaning you are a carrier, you have the infection. If you have an antibodies against the core, that's meaning you've been exposed to it, and IgM meaning you've been exposed acutely. The hepatitis E, that's meaning there is a viral replication, so you have the virus, and antibodies against the E, meaning you are in the seroconvergence, so hopefully you will become immune, and of course the DNA indicating viral replication. Hepatitis C is straightforward. Basically, you have the antibodies against hepatitis C virus, and antibodies, that doesn't mean you are immune to it. You know, that's meaning you have it, and of course the PCR is to see what's the level of the virus, what's the burden of the virus. Also, hepatitis E is more straightforward, whether you have the IgM antibodies, that's meaning you have acute infection, or IgG, that's meaning you had hepatitis A in the past. Hepatitis E markers, again, is a straightforward one. You have IgM for acute, IgG for history of exposure. Hepatitis E, as we mentioned, is an acute infection, so there is no carrier state, and you have the RNA PCR for it. Okay, how about autoimmune hepatitis markers? Well, you have the ANA, so mutual markers with lupus antibodies, as well as the anti-mitochondrial antibodies, as well as the anti-smooth muscles. Those are basically markers for autoimmune hepatitis. Okay, so this is just the خلينا نقول a time frame with hepatitis. Okay, so hepatitis B, the incubational period when you get exposed to hepatitis B, the incubational period is taking up to 3 months, okay? And then the clinical illness, يعني when you're gonna have the jaundice, تقريبا more than 5 years, it will يعني less than 5 years, only 10% of people, they will have the hepatitis B manifested within less than 5 years. The majority, they will have it after 5 years. Fatality rate, it's 1%. And the state of chronic infection, for those يعني gonna have a chronic infection, they will roughly less than 5 years. This is the natural history, and you can see there is a difference between those people contracting the disease during childhood comparing to the people contracted during adulthood. Okay? Focus with me. That might be actually important here. So when you get the infection during childhood, 90% they will develop chronic infection. Okay? Compare this to the adults when they get the infection, only 5% they will have a chronic infection. Okay? So mostly it will be an acute and the virus will be clear itself. Is this clear, guys? Very big difference between the children and the adults when they contracted the disease. You can say hepatitis B for children is a chronic illness because 90% will have it chronically, while in adults it's an acute illness because only 5% will develop chronic infection after that. Okay, what's the mode of transmission? Well, sexual, parental, and perinatal. Perinatal, that's meaning from mother to a child. What the concentration of hepatitis B in various body fluid? Well, basically it's high in the blood, in the serum, as well as in the wound exudate, while it's low or even sometimes not detectable in the urine and the feces and the sweat and breast milk. What are the complications of basically acute hepatitis? Well, they can develop chronic hepatitis and eventually cirrhosis and hepatocellular carcinoma, or it can go from acute hepatitis to fulminant hepatitis. What is the fulminant hepatitis? It's basically hepatic failure within 8 weeks of onset of illness, okay? So you are moving from acute to fulminant right away. Manifested by encephalopathy, abnormal liver function test, and prolonged PT and INR. And the histopathology usually will reveal a massive hepatic necrosis. Those are the causes for fulminant hepatitis to remember. We're going to talk about them in details, but for those people like to remember things in a mnemonic form, that will be useful to them. Okay. So let's talk about the transmission of hepatitis B in Saudi Arabia. Okay. Well, we have the horizontal transmission, which is from person to a person, and we have the perinatal transmission, which basically from mother to her baby, as well as heterosexual transmission, illegal drug use, contaminated equipment and therapeutic injection, and this can happen in a health care setting, folk medicine, الحجامة والحجامة والأشياء هذه, blood and blood product transfusion without prior screening. And this is hopefully we minimize the risk by proper screening, okay? So this is one of the biggest achievements for the Ministry of Health and the health system in Saudi Arabia, as you can see, okay? So in 1988, this is to tell you about the prevalence of hepatitis B service antigen, okay? Service antigen, that's meaning they are actually carrier of the infection. So you can see the positivity were at least 5%, at least, huh? But it can be up to 10%. This is in 1988, okay? So in 1989, the vaccination of all infants were established. In 1990, vaccination of all children at school entry, so to capture those people who weren't vaccinated during infanthood. And now, basically, vaccination are mandatory for all people, as well as we screen them before joining work. So now compare the prevalence before and after. So before in 1989 and after 1997. This is after 10 years. You guys see the difference? So those are the percentage, huh? Roughly from 5% all the way to 10%. This is age groups, huh? And after that, see, it's barely positive, okay? So this is considered as one of the biggest accomplishments for the health system in Saudi Arabia, minimizing and reducing the prevalence of hepatitis B in Saudi Arabia, okay? Again, this is based on the area, basically. Again, it's just huge reduction in the burden. Okay, how to treat hepatitis B? Hepatitis B treatment it's as complex as its markers, basically. I will say up front, you are not expected to remember those tables by your heart, but I'd like you to try to understand the gesture. Try to understand, for example, that a viral burden, a PCR, it's a factor to be considered when to treat a patient, okay? So it's depend on the numbers, okay? Also, the ALT is our markers when it comes to the liver enzymes in the treatment of hepatitis B, okay? So, for example, just an example, if you have the hepatitis B virus DNA less than 2,000, and the ALT is basically less than the upper limit of normal, so they are not elevated, you may actually opt to monitor and only to treat if they get worse, okay? What are the treatment options? Well, they are whether antiviral or interferon, basically, pick interferon. Okay. How about hepatitis C infection? Okay. Well, how to transmit hepatitis C? You have injection drug use. This is common both in our society, unfortunately, as well as in the Western countries. Okay. Clotting factor transfusion. This is before the viral inactivation. We are talking about people with, for example, hemophilia when they are get transfused with factor 8 or 9. Transfusion, blood transfusion, as well as transplant from infected donor, as well as contaminated equipment or unsafe injection practice, as well as, of course, the needle stick, and this is in our practice. Premucosal, we're talking about perinatal again, or sexual intercourse. So what are the features of hepatitis C? Well, the incubational period is let's say 2 months. The acute illness, jaundice, usually it's very mild. The case fatality rate is low. Remember, hepatitis B was around 1%. Here it's actually even lower. Look at how often they become chronically infected with hepatitis C, up to 80%. So hepatitis C, really, it's a chronic infection rather than acute, and certainly can lead to cirrhosis and causing a mortality when they become in a chronic liver disease state. Okay, well, a lot of question about the household transmission of hepatitis C. It's rare, but not absent. So it can occur. And this is why we usually advise people carrying hepatitis C to use their own razors, أدوات الحلاقة, own tooth brushes, and not to use it by any other family member. And of course, avoiding folk remedies and the contaminated injections. Sexual transmission of hepatitis C, it's occur, but the efficiency is very low, but we always have to counsel a patient about that. So the possibility is existent, but the chances are basically low. Okay, how about the nosocomial in hospital transmission of hepatitis C? Well, it can be happening with contaminated equipment, like in hemodialysis or endoscopy, or unsafe injection practice, like basically not cleaning the equipment, which can be disastrous if it is actually happen in a hospital or any other, let's say, medical institute. So what are the natural history of hepatitis C? Well, we know that rarely can cause jaundice and icteric state, and rarely can lead to fulminant. It's actually questionable, but mostly going to be actually in a chronic state, and eventually can lead to cirrhosis and hepatocellular carcinoma. So what are the treatments for hepatitis C? And I have to say, there is actually recently being a big achievement in the treatment of hepatitis C. Over the last 7 years, I think since 2013, we have really an excellent antiviral therapy to treat hepatitis C and to put people basically in remission and in undetectable viral load. Those medications mostly can be taken orally and basically have a way less toxic profile comparing to the old treatments. How to prevent hepatitis C? Well, avoiding sharing equipment like razors and tooth brushes, strict adherence to the universal precautions, especially in health facility. Don't forget hemodialysis and endoscopy are a potential risk of transmission, as well as education. Okay. Any question, guys? Does someone is asking, does liver transplantation is treating for chronic hepatitis? This is a good question. We don't usually transplant people when they have a chronic hepatitis. We transplant them when they have liver cirrhosis. So when they reach a cirrhosis level, or even when they reach hepatocellular carcinoma. So even if they have a hepatocellular carcinoma, transplantation will be an option. But when it comes to the treatment option for chronic hepatitis, whether for B or C, we're still talking about antiviral therapy. Good question. Any other question? طيب خلينا نكمل. Hepatitis A, it's it's common globally, and Saudi Arabia consider as high prevalence with hepatitis A, as you can see here. How we contract hepatitis A? Well, basically through close personal contact, but it's commonly actually through contaminated food or water, as well as rarely from blood exposure. Okay, you can see that it's rarely causing complication like fulminant hepatitis or relapsing hepatitis. Relapsing hepatitis meaning this acute hepatitis comes and goes. Like you get remission and then it will relapse. The incubational period is very short, actually, usually from 2 weeks to 4 weeks. Okay. Usually they will have jaundice. The fecal-oral route is the most common mode of transmission, whether through personal to personal or contaminated food or water. So to prevent that, we need to be strict with the hygiene, sanitation, and drinking from clean water. And this is important for those people going to be traveling to basically area with high prevalence of hepatitis A. Don't forget to take the vaccination. So there is a vaccination for hepatitis A, and if you get exposed to it, you may consider taking immunoglobulin. Those are the vaccination, and you can see that they are actually they haven't tried it, the efficacy. They are actually very efficient vaccination. Okay, usually they are taking in 2 doses formula. Okay, so acute liver failure. Well, we went over the definition of it, but I'm just writing it down. It's basically an onset of hepatic encephalopathy and prolonged prothrombin within 26 weeks of occurrence of jaundice or other symptoms of liver inflammation in the absence of chronic liver failure. So basically, acute liver failure is having basically a failing liver happen acutely with no evidence of chronic liver failure. What are the causes? Well, acetaminophen, tinolone is at the top, as you can see. Hepatitis A, hepatitis B, HSV are common viruses to cause that. Autoimmune hepatitis, other medication can cause that, as well as some sort of mushroom. And don't forget the acute fatty liver of pregnancy. So how to treat acute liver failure? Well, the diagnosis requires immediate referral to liver transplant center, plus treating the underlying cause. Prompt treatment is crucial. So, for example, if you have someone with acetaminophen intoxication, we'll give them N-acetylcysteine, okay, what we call it NAC. When you have someone with hepatitis B virus or HSV, we'll give them antiviral medication. When you have someone with mushroom poisoning, penicillin G is the treatment. When you have a pregnant lady with acute fatty liver of pregnancy, delivery of the baby is the key. So treat the underlying cause. Okay? Okay. Time for question, guys. أحد عنده أي سؤال؟ إذا ما حد عنده أي سؤال let's regroup at 10:10 ها. let's take a good break ربع ساعة كده بكم تصحصحون للموضوع الثالث 10:10.
طيب تمام يا دكتور، بس ننبه عليهم إن الساعة 10 هيفتح التحضير الثاني، فيكونوا مركزين ويحضروا في البريك.